10th October every year is Mental Health Day, an international day for mental health education, awareness and policy advocacy. This year's theme is Mental Health in an Unfair World. We go to the streets of Kitwe to ask people on what they understand about mental health.
Mental health is the condition in which your mind is. If your mind is okay, then you'll be able to reason well and think well and relate well to other people. But if your mind is not okay, it is very, very difficult for you to reason, and also it also affects the way you behave towards other people.
Well, mental health, I think it's a standard that we consider to be a normal way of thinking, a normal way of how the brain is supposed to operate. That's what I think mental health is.
It's the status of your mind, the way you think, the way you behave, the way you relate with people actually comes from the status of your mind, I would say. So when you talk about mental health, there are a lot of things that happen in one's life that can cause someone to behave a certain way or speak a certain way.
Mental health is to do with disorder of the mind. Someone is not in the right state of mind. That comes by probably getting depressed, or maybe somebody has gone through a certain phase in life that has made them just get into that kind of state.
We are now going to talk to Sydney Mbilikita, a guidance teacher at Ipuskilo Primary School, who's going to share with us the connection between mental health and academic performance.
Mental health is interrelated with academic performance to a student, in the sense that you cannot rule away, or rather rule out, academic performance with mental health. And you also need to note that mental health comes with a lot of challenges. There's a lot of stress, anxiety, low levels of energy, and also concentration when it comes to classwork. So it's important to note that a child who needs to perform well at school needs to be mentally healthy.
Randy Muya is a registered mental health nurse. She now shares with us the activities that have been lined up in commemorating this year's Mental Health Day.
The theme is actually mental health in an unequal world. So the theme highlights that access to mental health services remains unequal, with between 75 to 95% of people with mental disorders in low and middle income classes. Yeah, so these people are unable to access services at all. So we also have stigma and discrimination. Stigma and discrimination also plays a role, as in people not seeking mental health services at an early stage. So they usually come when symptoms have already exacerbated, So mental illnesses affects the patient's educational opportunities and future job prospects, and also affects their loved ones and families. So this inequality needs to be addressed, because it should not be allowed to continue. We all have a role to play to address the disparities, to ensure that people with mental illnesses are fully integrated into the society. A variety of services that we offer: we do counseling on drug and alcohol abuse. Yes, as you know that these disorders are now on the rise. Yes, we also counsel parasuicides. Yes, we screen patients with mental disorders. We do psychological assessments on children with neurological disorders. We also see patients with epilepsy, and we also do stress management, either on a one-to-one basis or as a family therapy. The common mental disorders are alcohol and substance use mental disorders. These are on the rise, with people abusing Atem, morphine, and marijuana is also on the rise. Yes. We also have bipolar mood disorders, which include mania and depression. We also have anxiety disorders, and we also have schizophrenia. What we've lined up are school health services. We'll go into schools and talk about, drug and alcohol misuse. It's also on the rise in schools. School-going pupils are abusing most substances, especially Atem, codeine. They would even put in bottles of water. So teachers wouldn't even know that they're abusing, or they are sniffing the same drug, because it's usually mixed in a bottle of water. So nobody would tell. And we've also lined up radio programs. We usually do with the Radio Ichengelo, sensitizing people on mental health disorders, yes, and TV programs as well, just like we are doing on ZNBC. Then one-on-one counseling sessions with our patients and their relatives, family, also is very important. Yes, we also do, we've also partnered with churches. People out there, they should know that mental illness is real. It can affect anyone, yeah, regardless of race, yes, age, anyone can be affected of mental illness.
I hope we have learned one or two things. Indeed, if we can detect behaviors that are unusual early enough and avoid vices that are going to corrupt our minds, we are going to have a good mental health. Sezuni Nasinda reporting for Kwacha. Good morning, Zambia.